Hello students, I am Dr. Barkha Bhoneja. I'm a senior lecturer at the Department of Prosthodontics, BBD College of Dental Sciences, BBD University. And we are going to cover a very beautiful topic today, the articulators, which is the heart of prosthodontics. So articulators in complete denture construction. So the content of this webinar will be introduction, minimal articulator requirements, the additional articulator requirements, classification of articulators, laws of articulation, articulator selection, limitations of an articulator, and references. So first, let's go to introduction. An articulator may be defined as a mechanical device that represents the temporomandibular joint and jaw members to which maxillary and mandibular casts may be attached to simulate jaw movement. So this is the definition of glossary of prosthodontic terminology, and it says it is a mechanical device which basically is representing your temporomandibular joint and your jaw members, that is the maxilla and the mandible. So you take the impression of maxilla and mandible and you take the relation of both of them together and you mount it into the articulator. So now the articulator is acting like a temporomandibular joint to which the maxillary and mandibular casts are attached to simulate the jaw movement. Simulate means to copy or to replicate. An articulator is used to simulate the patient's temporomandibular joints, muscles of mastication, mandibular ligaments, mandible and maxilla, the complex neuromuscular mechanism that programs mandibular movement. So it is such an amazing device that is representing all of the complex structures which are present in the human mouth into a mechanical device so that it becomes very easy for you to fabricate the prosthesis. Now, the advantages of an articulator. Properly mounted casts allow the operator to better visualize a patient's occlusion, especially from the lingual view. So, because of a lot of saliva, tongue, buccal mucosa, and all of the things that is hampering your view into the patient's mouth, these all are eliminated into the articulator. And the most important advantage is it gives you access to see from the lingual side, which is not possible when we are working on the patients. Patient cooperation is not a factor when using an articulator once the appropriate interocclusal records are obtained from the patient. So every time you have to work, you have to call the patient, you have to make the patient wait, and then you have to do all the necessary steps that you have to do for fabrication of a prosthesis. So it takes a lot of time, energy, and efforts from the patient side. Now, all of these factors, they are eliminated when we are working on an articulator. So patient is happy, the doctor is also happy. And once now you have to articulate it once you appropriate interocclusal records. What are interocclusal records? It is the record which is basically showing you how your mandible is present in relation to your maxilla. The refinement of complete denture occlusion in the mouse is extremely difficult because of shifting of denture bases and resiliency of supporting tissues. Now, the meaning of this line is when we are at the end stage of complete denture, we are delivering and we have to do the selective grinding of the occlusion inside the mouth. So you have to put a lot of different colored articulating papers into the mouth. There is saliva, there is tongue, also because of that the denture base may or may not be stable enough for you to give that proper occlusal marking, and then you have to take it from the mouth. You will have the all saliva, then you have to wash it. You have to, while washing, the marks may also be gone. So when we do it on the articulator, all of these factors are eliminated. You can simply put your maxillary and mandibular denture bases over the cast. You can put the articulating markings, and the procedure is very fast and smart. The patient's saliva, tongue, and cheeks are not factors when using an articulator, as we have discussed it before. Now, minimal articular requirements. So while fabricating such a mechanical device, there might be certain requirements to be fulfilled for it to be actually useful for us. So they have certain minimal articular requirements and certain articulator requirements that we have to fulfill. The articulator must accurately maintain the correct horizontal relationship of the patient's cast. Now, this is basically a stimulation. Now, the stimulation may only work when you copy and paste in the right direction and you copy the right file. So once you copy the correct horizontal relationship of the patient's cast and move into the articulator, then only the articulator will function like what is that in the mouth. The patient's cast must be easily removable and attachable to the articulator without losing the correct horizontal vertical relations. Every time for every procedure, you might have to take it out and put it back. Or maybe you are doing, you have one articulator and you're doing other patients, you have to also have the cast of the other patients to be recorded into the articulator so that the previous job can be easily removed and be detached and attached, reattached to the same position that you had previously mounted. The articulator should accept a phasebow transfer utilizing an anterior reference point. The anterior reference point, okay, so there are basically three reference points. To copy a plane and to put it into a machinery, the plane has to be a three-dimensional. So three-dimensional points you have to register. So you use a phasebow record to three-dimensionally orient or take the record the orientation of maxilla, and that maxilla is then articulated into the articulators. So we take an anterior reference point. Anterior is all over your face, some point which are certain reference points that have been mentioned by certain authors that you have to take. So you take a point which is anterior of your face and 2 points either side of the face which are posterior. So these becomes 3 points. Now, the articulator should accept a phasebow transfer utilizing an anterior reference point. The phasebow transfer relates the maxillary cast to the horizontal axis of the articulator in the same manner that the patient's maxilla relates to the opening axis of the temporomandibular joint. So that means the maxilla in relation to the base of your skull is basically, this is what recorded by a phasebow. Now this record is then transferred to the articulator. So in articulator, when you mount this maxilla, so the maxilla will be mounted similarly that is present in relation to the base of the skull. Now the articulator should have an incisal pin with a positive contact and an adjustable and calibrated. So incisal guide pin, that is the anterior rod which is present into the articulator, which forms an anterior stop. The articulator should be able to move and close in a hinge-like fashion. Hinge means opening and closing in a hinge-like action. The construction should be accurate, rigid, and of non-corrosive material. So it should be precisely accurate, it should be rigid, it should not be flexible so that your record stays like that, and non-corrosive material. So it shouldn't be like you are investing so much, you're buying a expensive articulator, then the material corrodes and then everything goes haywire. The moving parts should move freely without any friction. So there shouldn't be any hamperage in during the movements, which will in turn hamper your work. The non-moving parts should be a rigid construction. So there are certain additional requirements which may or may not be present in an articulator. So these articulator requirements are necessary if the denture has to be done with the balance occlusion. Okay. So the condylar guide should allow right lateral, left lateral protrusive movements. So these type of movements are basically moving your jaw left, right, and in front. So the condyle is what guides the movement of the mandible, all these directions. So this condylar guide should be present into the articulator. The condylar guide should be adjustable so that the inclination of the condyle which is present can be easily recorded into the articulator. The articulator should have provisions for adjustment of Bennett movement. Is the mandibular condylar shift is called as a Bennett movement. The incisal guide table should be a mechanical table that can be adjusted in the sagittal frontal planes, or a table that can be customized with autopolymerizing resin or by grinding. That means the table, the incisal pin rests on the table. Now this table should be adjusted anteriorly, posteriorly, left and right, so that to stimulate your movements of the mandible. Okay, optional requirements may be, adjustable intercondylar distance and immediate Bennett shift. The immediate Bennett adjustment primarily influences with the width of the central grooves of the posterior tree. Now, these Bennett adjustments are basically a complex procedures that we may or may require for full mouth rehabilitations and all the other purposes. The articulator may either be Archon or non-Archon, which I'll further tell you about in my further lectures. The primary advantage of an Archon articulator for complete denture construction would be for the visualization of condylar movements. Archon articulators, I will explain to you this point. And Wenberg was not able to demonstrate any mathematic evidence that either an Archon or an Archon instrument is superior. So both of them are equally similar. So in the next lecture, we will be moving on to the classification of the articulators. That is for today. Thank you.